If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Rheumatoid arthritis is Rheumatoid arthritis most often requires a long-term treatment and a lot of lifestyle changes. You need to understand that treatment can include a lot of things. It can include medicines, physical therapy, exercises, sometimes surgeries, and the most important fifth thing is education. You need to understand your disease. And the most important thing here is early and aggressive treatment. Early and aggressive treatment for rheumatoid arthritis with newer drugs can be very helpful to slow the joint destruction and prevent deformities. Now let's talk in short about these drugs. The first drug is DMARDs, disease modifying anti-rheumatic drugs. These are the drugs that are tried first in the people of rheumatoid arthritis, and these are prescribed along with rest. You need to take proper rest, strengthening exercises, and anti-inflammatory drugs. And what are these drugs, DMARDs? These are methotrexate, which is most commonly used, then leflunomide and hydrochloroquine can also be used. Then sulfasalazine is a drug that is often combined with these drugs. Sulfasalazine is often combined with methotrexate and hydroxychloroquine as a triple therapy. It may be weeks or months before you can see benefits from these drugs, so you need to make note of that. And these drugs may even have some very serious side effects. So you will need to do regular blood tests when you're taking them and regular visits to your doctor. But if you do nothing, then the disease will progress and you will have joint deformities, restriction of motion, the problem will increase. So you need to go to a doctor and listen to them, trust them. Then the second type of drug is anti-inflammatory medicines. These includes non-steroidal anti-inflammatory drugs, NSAIDs and aspirin. These drugs work well to reduce the pain and swelling. Long-time use of these drugs can cause a lot of side effects also, like stomach problems. They can induce ulcers and even sometimes ulcers can bleed. Sometimes even heart problems can happen because of these drugs. So again, that does not mean that you stop taking these drugs. That just means that you have to be cautious, do regular tests, go to your doctor regularly. And when I talk about these side effects, that does not mean that every single person taking these medicines will have side effects. These are seen in some people. Now, the important point here about anti-inflammatory medicines is that they do not prevent the joint damage. They do not prevent the progress of the disease if used alone. So you have to and should include DMARDs into the therapy. Then the third medicine, as we talked about, is hydrochloroquine, which is an anti-malarial medicine. Yes, but they are used along with DMARDs like methotrexate, and it has been seen that they give a better result with a triple therapy along with anti-inflammatory medicines. The fourth medicine is steroids, corticosteroids. These medicines work very well. They are very well and they reduce the joint swelling and inflammation also very fast. But they should be used only when they are required. They should be used because they can have long-term side effects. Some side effects are which come and go for a few days. You might have stomach problems, you might have other things, nausea, but these steroids can have long-term side effects on your body. Therefore, they should be taken only for a short time and in the lowest dose possible, and only after consultation with your doctor if your doctor thinks they are needed. Then the fifth thing is biological agents. These drugs are designed to affect the part of the immune system that plays a role in the disease process of rheumatoid arthritis. These biological agents may be given with other medicines. These biological agents may be tried when other medicines for rheumatoid arthritis do not work. And sometimes these biological drugs are started sooner also along with these drugs. However, you need to know that these biological agents are very expensive. And most of these are given either under the skin or into a vein. And there are several types of biological agents. These biological agents can be very helpful in treating rheumatoid arthritis. However, again, people who are taking these drugs must be watched very closely because some serious side effects can happen in some of the people. Because these biological agents can have serious side effects. Sometimes these side effects can include infections. Sometimes you can have allergic reactions, and sometimes you can have skin allergies like psoriasis over the skin. Sometimes even there can be leukemias or lymphomas as a side effect of these biological agents. So therefore, which treatment, which medical therapy should be given to you should be decided by a specialist, a rheumatologist. Then apart from medical therapy, there are some surgical therapy. Just like I said, if your finger gets very stiff, then surgery may be needed to correct severely damaged joints. Surgery can include removal of the joint lining, the synovectomy, the stiff covering of the joint is removed. Then sometimes the total joint can be removed in extreme cases and the joint is replaced. This can include total knee replacement or hip replacement. So these can be done. Another option and very good option is physical therapy. Physical therapy basically involves range of motion exercises, and exercise programs are prescribed by physical therapists, physiotherapists, and these exercise programs can actually delay the loss of joint functions and keep the muscles moving and strong. Sometimes these physiotherapists will use special machines to apply deep heat or electrical stimulus to reduce the pain and improve the joint movements. You yourself should always try to keep your joints mobile and keep them moving because that will help prevent joint stiffness. Then other therapies which may help ease your joint pain will include joint protection technique, heat and cold treatments. You can use splints or orthotic devices to support and align the joints if there is already some deformity. And frequently you need to do rest between the activities. You need to take rest periods and then be active. Activity is very important, but you cannot be active 24 hours. So you have to take frequent rest periods between activities as well as 8 to 10 hours of sleep. So that's very important. Then coming on to nutrition. Some people with rheumatoid arthritis may have an intolerance to or allergy to certain foods. So a balanced nutritious diet is recommended, and it is helpful to eat a lot of foods which are rich in omega-3 fatty acids. Smoking is very bad, it should be stopped. Alcohol is bad. Excessive alcohol should not be taken. Then you need to join some support groups. People benefit by talking about their arthritis in support group. But see, basically the prognosis depends upon how well you get involved into your treatment and also the severity of symptoms. Right? It is very important to have a regular return visits. So have a regular visit to your doctor who will adjust your treatment according to arthritis. There cannot be possible that he gives you one medicines for a few days and your arthritis is gone. No, that's not going to happen. And if you don't take proper treatment, permanent joint damage will happen. Early treatment with a 3-drug regime, like I said, triple therapy or a biological agent can decrease your joint pain and damage. and this will help in improving the prognosis of the disease. And it is possible to have remission of rheumatoid arthritis without needing future medicines if the treatment is started very early and strongly with these drugs. And these drugs are only given by specialists called rheumatologists. You need to go to them. Remember, if not treated properly, rheumatoid arthritis can affect nearly every part of your body. Complication can happen to your lungs, complications can happen into your arteries can harden, leading to further complication. You can have heart attack because of that. You can have spinal injuries when your neck bones become damaged. There can be inflammation of blood vessels, rheumatoid vasculitis, which can lead to skin, nerve, heart, brain problems. The swelling and inflammation of outer lining of the heart, pericarditis can happen, right? And even the heart muscles can become inflamed. Myocarditis can also happen, which can lead to heart failure. So rheumatoid disease can happen. So this disease can spread to the heart, the blood vessels, the bones, the lungs, arteries, anything. However, these complications can be avoided with proper treatment, and the treatment can also cause side effects. Therefore, don't forget to go back to your doctor repeatedly. Don't forget to get tested repeatedly. Is there anything which you can do to prevent this disease? No. There is no known definite prevention, but yes, smoking cigarettes along with long-term gum infections appear to worsen rheumatoid arthritis. So it is important to avoid tobacco and maintain healthy teeth and gums. Proper early treatment can help prevent further joint damage. Remember that. And very, very important is self-management programs. Very important is your own self-involvement in your treatment. You cannot have others taking care of you always. You need to understand the disease. You need to reduce the pain while remaining active. You need to cope physically, emotionally, mentally. You need to feel greater control over the disease and build a sense of confidence in the ability to function and lead a full, active and independent life. So that's very important. If you do this, the symptoms, the problems will be least. I hope this helped, guys. You're not alone. A lot of people are there who are suffering from this disease, and we are trying to develop better drugs. Till that time, make sure to talk to your rheumatologist and keep watching my videos. If you have any questions, do ask them here. I'll try to answer them, or you can talk to your rheumatologist. Till next time, I'm Dr. Paramjeet. Those who don't know me, I'm a consultant physician and cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, NCR, and this is my channel, Dr.Education. I give authentic and simplified medical information about various healthcare topics. I try to teach you why you get sick and how you can get better. So, till next time, stay connected, stay healthy.